Action News starts now.
A new report is warning of a rise in future cancer cases.
But there are some new ways to treat the disease that are brightening the outcomes for some patients that are battling more serious forms. The shift toward early detection and targeted treatments is our big story today.
A new report is saying that cancer cases are expected to rise in the coming decades. Nearly 21 million people were diagnosed with cancer in 2024 alone. That according to the World Health Organization report. By 2050, they expect that number could soar to 35 million. Now, despite improvements in cancer surveillance and treatment, global health care inequities, they're driving more cases and unfortunately more deaths. The report says most of the new cancer cases will come from lower income countries with less access to treatment. So the World Health Organization says cancer rates are differing by region. Let's take 2024. Asia accounted for the largest share with more than half of all cancer cases and deaths. Health officials say this reflects the region's large population. Europe contributing 21% of global cases and 20% of the deaths. That despite having only about 9% of the world's population. Now, in contrast, many countries in Africa and parts of Asia are experiencing lower incidence but higher mortality rates. Lung, prostate, and colorectal cancers, they are among the most common in men. Women more likely to suffer from breast, lung, and colorectal. Lung cancer, that continues to remain the leading cause of cancer globally.
And this year alone, lung cancer is expected to kill nearly 125,000 Americans. That's according to the American Cancer Society. And many of those people who die have stage 4, the most advanced stage of that disease. But as Mandy Gaither explains, there's a new study providing hope for some of these patients when every other treatment has failed.
Before 2019, lung cancer may have been the last thing on David Peterson's mind. But when this non-smoker had a cough that wouldn't go away, he got the shock of his life.
It turned out I had stage 3 lung cancer.
The tumor was surgically removed, but about a year later, the cancer returned with a vengeance, now growing in both lungs despite every treatment thrown at it. Peterson progressed to stage 4.
Nothing was working, and I was completely out of options.
That's when Peterson found Northwestern Medicine's DREAM program. Thoracic surgeon Dr. Ankit Barrett says there's a long-held belief that terminal lung cancer patients shouldn't receive lung transplants. But in this study, Barrett and others researched what happens when they do.
It really is designed to serve as the last option when everything else has failed.
17 out of 98 stage 4 lung cancer patients studied who met certain criteria underwent a double lung transplant. The 81 others received medical management alone because a transplant wasn't an option. Researchers say 100% of transplanted patients were alive 1 year after surgery, compared to a 41% one-year survival rate among the patients treated with medical therapies alone.
It offers the possibility of hope to many, many hopeless patients.
I had about 2 months more to live.
That was then. This is now. Nearly 3 years after receiving 2 new lungs, Peterson remains cancer-free with no signs of organ rejection.
Don't give up.
Mandy Gaither there reporting. Another part of the study includes researching multiple cancer sites from the lungs that were taken out of those stage 4 lung cancer patients. The doctor you just heard from said it's all an effort to understand why traditional therapies were not helping. Researchers discovered that the different sites had different patterns of resistance that were available to the medications. That means no effective medical regimen could be created for the patients with the advanced lung cancer. So in those cases, organ replacement, that was the only way to get them better.
Well, now to some new hope against one of the deadliest forms of cancer. An FDA-permitted drug for pancreatic cancer is now reaching its very first patients. Here's ABC's Morgan Norwood with the exclusive look.
A groundbreaking new medication in the fight against cancer is giving hope to patients.
Unbelief, it's positive, it's happy, exciting, and I'm floating.
The drug called daraxonrasib is a once-daily oral pill, FDA permitted through expanded access programs like the one here at City of Hope.
Here goes.
Go for it, Mom.
The pill blocks a protein that helps cancer cells grow and has been shown in recent clinical trials to double overall survival in advanced pancreatic cancers compared to chemotherapy.
This is a very unforgiving disease, and it's one more lifeline for these patients. And a better lifeline than anything that we've seen before.
Everything is good.
At City of Hope, the freedom that the pill offers 88-year-old Barbara Andes gives her the power she thought she lost.
This is going to give me more activity in my life, which I will appreciate tremendously, and learn things and enjoy things and be with my family. I am going to own my life again.
Morgan Norwood, ABC News, New York.
Ovarian cancer is one of the leading causes of cancer death among women. That, according to the American Cancer Society. As we reported, a shocking amount of these cases are not caught during routine checkups. Researchers looked at 28,000 ovarian cancer patients in the UK, and of those, 40% learned of their diagnosis within 28 days of an emergency medical visit. And according to the study, only a small number of those cases were caught at the early stages. Researchers warn early detection is vital to a patient's survival.
Some of the early symptoms of ovarian cancer can be subtle, such as abdominal pain, bloating, pelvic discomfort, or changes in bowel habits, and this can mimic what you might feel from a lot of different medical conditions. So if people really wait until they have emergent symptoms, you can imagine that's a later stage of ovarian cancer.
Doctors say age, socioeconomic factors, and underlying medical conditions could cause delays in care, among other factors. They add that if you notice any of the subtle symptoms, you'll want to seek medical care sooner rather than later.
And of course, summertime means spending time outside, which can expose you to UV rays. Those UV rays can damage your skin over time, potentially leading to skin cancer. Every year, more than 5 million Americans are diagnosed with skin cancer. But doctors say nearly all skin cancers are treatable if they're caught early. They recommend checking your skin once a month for any new spots or changes in size, shape, or color. And if you notice any lesions changing over time, bring it up to a doctor.
You should seek professional advice if you have any lesions that you've noticed are changing over time. Patients who are more at risk for melanomas are patients who have a personal or family history of any melanoma or any skin cancer. People who have fair skin, people with moles, or anybody who's had increased sun exposure, including tanning bed use in the past.
Now, there are some simple ways to prevent skin cancer. Avoid being outside between 10 and 4. That's when the UV rays are strongest. Also wear a shirt, SPF level 30 sunscreen, a hat, and UV blocking sunglasses.
And the FDA recently approved a new sunscreen for the first time in 20 years. And the attributes of the new product might encourage more people to start using sunscreen to ward off aging and skin cancer. Here's Terry Russell.
Currently, Americans have two kinds of sunscreens from which to choose. There are the barrier sunscreens, which contain ingredients like zinc oxide. As the name implies, it acts as a barrier to the sun's rays. Chemical sunscreens absorb UVA or UVB rays and dissipate the heat. But beginning next month, a third option will be available called bimotrizanol.
So it has been used in large populations for an extended period of time, and it has been shown to be safe. So I think Americans can feel confident that this is a safe product to use.
Bimotrizanol falls under the chemical sunscreen category. However, it's known to be photostable. That means it absorbs both UVB and UVA rays and degrades slowly when exposed to the sun. Added with other chemicals, they too become more stable. Molecules contained in bimotrizanol are larger than those contained in traditional sunscreens.
So people have a concern with sunscreens being absorbed through their skin. And there is like a 2 to 5% chance of skin absorption with things that you place on the skin. However, because bimotrizanol is such a large molecule, it is much less likely to be absorbed.
Initially, the product will be found under the name Partial Shield. But after 18 months, sunscreen manufacturers will be able to combine the product into their own name brands. Dr. Zaleski Larson says for those with sensitive skin or for people who don't like the white sheen left on skin from barrier sunscreens, bimotrizanol may be a great alternative.
I'm very excited to see what this brings us in the future.
And the fight against cancer, it's an ongoing battle here. For the latest developments on improvements in diagnoses and treatments, we'll keep you updated both on air and online and wherever you stream 13 Action News.
All right.